Towards the crowd. Okay, hello everyone. Welcome to another talk of METUMIR. And today we have a distinguished speaker who is also a METU postgraduate student as well. So we're lucky to have Omar. Omar Kadkoy is working for TEPOF, and he's going to be talking about the challenges facing Syrian and Afghans in Ankara during the COVID-19 pandemic. Omar is a policy analyst at the Economic Policy and Research Foundation of Turkey, where he works on the socioeconomic dynamics of the forcibly displaced populations. His research focuses on incorporation policies in Turkey, and particularly in the fields of citizenship and the labor market, and the evaluation of the subsequent legal adjustment. Omar is also a master's student of international relations at METU. Thank you so much, Omar, again. And the floor is yours. So,
thank you very much, Professor, for the introduction. And I will immediately share the presentation so we can start immediately to compensate for the time we missed a little bit. So yes, no, not this one.
Too many meetings and online meetings.
Exactly.
I think one after the other.
All right. Everybody could see the screen, no?
Yes, I think it's clear.
Okay. All right. So this is going to be, or like, this is a summary of the findings that we have came across from a project that I am working on as we speak. It has a different title, but I selected only the part that focuses on the challenges facing Syrians and Afghans in Ankara during COVID-19 pandemic, as being just a part of the greater scope of the project. The remaining parts, or the remaining themes of the project also include how municipal policies change or did not change during the COVID-19 pandemic, and whether they were inclusive to forcibly displaced migrants in Ankara. And it also sheds light on the NGO activities during this time, and whether they had challenges in terms of accessing or providing their services to their beneficiaries. But again, as I said, this is only a part that focuses on the challenges facing Afghans and Syrians in Ankara. And for that matter, this is going to be something, it's going to be a short presentation. Don't be afraid of the points that I raised in the framework. We're going to go through the basic demographic and legal status information that we got, and then we're going to dwell into the language skills and educational attainment of the household representatives, their employment status, what sort of income.
Sorry to interrupt, but can you make the presentation as one slide, like the whole screen?
Oh, yes.
I think it's going to be more easier.
Yes.
Okay, thank you.
Okay. Aside from that, we will see also how the need of the households we interviewed changed during the pandemic era, and what sort of implications did the pandemic had or have still actually on their reachability to basic services and items as well. And particularly, we pay attention to implications on children's education, because this is one of the most important maybe implications or consequences on refugee children or forcibly displaced children. And then we end with repatriation to see whether the breakout of the COVID-19 pandemic in Ankara particularly, I cannot say Turkey, it changed the minds of those who are in Ankara, and whether they want to repatriate because they have come through more challenges during this time. So the sample includes 50 households in Altındağ, Yeni Mahalle, and Mamak districts of Ankara. The selection of these three districts is based on the fact that they host the highest number of Syrians, but the incorporation of Afghans into this project was actually to have an element of comparison, one. Two, for the last few years, in like almost a decade, most of the attention has been paid to Syrians in Turkey in general, overshadowing other groups of forcibly displaced migrants here in Turkey in general as well. So this is why we included Afghans in this study. The numbers, like out of the 50 household interviews we did, 17 of them were with Syrians and 33 were with Afghan households. The numbers capped after reaching saturation of the interviews with each group of households. And we've seen that the average household size is 5.1 members, and each household has an average children number of 2.8. Here I have to clarify one specific point. The total number of children households reported to have is 179, but the ones who are living in the households at the time of the interviews was 136. The difference between the two numbers is due to having children elsewhere, either still in the countries of origin or in Turkey, but residing in different provinces for either school or work. So it's the 2.8 average number of children is calculated based on the fact that there are a total of 136 children living in the households at the time of the interview. The civil status, as you can see, of household representatives is based on three categories. Marriage, 36 household representatives are married, 10 are widows, and 4 are divorcees. And when we look at the female-male breakdown of the household representatives, we see that 36 of the household representatives are women, and the remaining number are males. So from there, we go to the legal status of the interviewed household representatives. And we see that because the majority of the household representatives are Afghans, they are mostly under international protection. And it is only Afghans who are holding residency permits and undocumented. And the remaining 17 representatives of Syrian households are registered under temporary protection status. And here it's also worthy to mention that when you are when you have a residency permit or you are undocumented, you don't have free access to health services. You have, well, if you are undocumented, you cannot access the health services. And there have been some reports saying that even when they were not from our work but outside of our project, stating that when they went to the hospitals, they were fearing deportation because the hospitals are obliged to notify the police when an undocumented person as a foreigner comes and receives the health services. So this has been a fear factor in not reaching out for health services. When you are registered under, or when you have a residency permit, for example, you have to pay when you go to even a public hospital, unlike the case if you are under temporary protection status or international protection. And when you are a holder of a residency permit, you cannot, for example, benefit from ESSN or Kızılay card, otherwise known as Kızılay card scheme. And aside from that, you cannot also, or you have, for example, an advantage of mobility in Turkey, unlike being under temporary protection status or international protection, or I don't know whether they are required for mobility permits similar to Syrians under temporary protection status per se. But if you have a residency permit, you have the advantage of, let me say, not applying for a permission if you want to get out of your province of registration. And from there, we go to the basic indicator of like Turkish language skills. And out of out of the 50 households, 28 household representatives stated that they know Turkish, but only one household representative stated having a language certificate, and that is the person who studied Turkish in the university. And if you look at the means of how they learn Turkish language, we see that the majority of them dependent or like they dependent on their own means, meaning that while working, they picked up the language, or while maybe being in the neighborhood and interacting with their neighbors, Turkish neighbors, they started picking up some language skills. Four household representatives went to language courses, but they had to drop out before the pandemic, either because they found a job, so they couldn't attend the language course anymore, or because they had children and they couldn't leave them anymore. Yet those who attended language courses did not reach a point where, like, they were tested for the levels they finished. Hence, they don't have a certificate saying that they have reached this level of Turkish language. And for example, one of the things that you will see in related to relatively poor language skills of Turkish, Ankara's metropolitan municipalities campaign of Suver during COVID-19, 85% of the interviewed households stated that they are not aware of that. So this could be somehow linked to the poor language skills, because mostly when you want to pick up and that's something also you will see in the report, when you want to pick up information on similar announcements made not only by the municipalities and even any Turkish institution, they resort to social media. And these social media platforms they resort to are either Facebook or Instagram or Twitter. But these posts or tweets or Instagram posts are in their language, in their own language. So they do not really depend on their language skills, Turkish language skills, to navigate these updates provided by the government or the campaign similar to what Metropolitan Municipality of Ankara did. And when we look at the educational attainment of the household representatives that we interviewed, we see that 20 of them are either illiterate or literate, but are school dropouts. This, you can see here a breakdown according to female male binaries, and also Syrian and Afghans. And as you can see, illiteracy rates or being literate but being a school dropout is more prevailing among female Afghans compared to female Syrians. Yet the overall educational attainment of Afghans is much better than Syrians when compared to those who are graduate of a certain educational level. And as you can see, also, like, there are two household representatives who are university graduates, and both of them are Afghans. They are not Syrians. Now, when we talk about employment or employment status at this time, we've seen that while 26 household representatives used to work in their countries of origin, only 17 work now in Ankara. And again, as you can see, there is a breakdown according to male and female division and nationality as well. Yet those who used to do, for example, or used to work in their countries of origin, we've seen that they were either public servants, daily workers, and tailors. Those were the top three professions that they used to work at. And for example, how does this translate in being in Turkey? Those who were public servants cannot certainly do the same work they used to do there, because you have to be, well, a Turkish national to be employed at the public sector to begin with, let alone whether you have the diploma that you graduated with and its equivalency, whether it's available or not. So like, it's more complicated than saying that they are just like working or not working per se. when we looked at the employment sectors they fill while here in Ankara, we see that they are also doing daily jobs, the majority of them. And those who used to work as tailors in their countries of origin are also working as tailors here in Ankara. But the majority of the, or all of them who work nowadays, they are working informally. And in a COVID-19 context, this means that the announcement of the government to have this financial support, kısa dönem ödemeyi, like they cannot benefit from this scheme because they are informally employed. And we've seen that there have two household representatives stated that being laid out of work because of COVID-19. And the majority of the households, like we say that like 33 household representatives are not working in Ankara nowadays. When we looked at the reasons why they are not working, we saw that these are women-led households. The majority of them are women-led households, and they are unable to work because they either have to attend or care for their children, or they have some sick household members. Again, this is why the reason why they cannot get out of their houses and find employment opportunities. Now, with this, we go to household income and expenses. And out of the 50 household representatives that we interviewed, only one household representative did not answer questions related to income and expenses. But as you can see, the majority of household representatives are either making the same, they spend the exact amount of money they make, or they are in debt because their expenses are greater than their income levels. And only 3 household representatives are able to actually have a financial safety, meaning that they are able to save some sort of money and they have a greater income than the expenses associated with the expenses of the household. Now, if we look at the gender breakdown and the nationality breakdown of this, we see that 21 households they are they make below 1,000 Turkish liras a month, and you can also see that the majority of them are females. They are not males. And aside from that, the average expense, for example, of a household in terms of rent is around 550 Turkish liras, if I remember the number correctly. And it is associated also with an average of 285 Turkish liras for utility expenses. So we're talking about something around 850,000 and 50 Turkish liras a month just to cover rent and utility bills. So this shows us that, you will see this later on when the report comes out, that the dependency on ESSN is due to this fact. And I have to cite the following fact as well. Usually speaking, and this is not specific to Afghans and Syrians in Turkey or like Turks in the country, there is no way of actually harvesting accurate information about this specific question, whether it's households or whether it is even companies. So this is why we gave them ranges of income and expenses, so they can just tell us that yes, it is in the range of this and that sort of answers, but it may not be completely accurate data, because nobody would want to reveal how much money they make or how much money they spend. And because of this financial situation that they have, when asked about what sort of need for aid they have, the majority of them said that they want financial aid to compensate for the expenses they have compared to the income level flowing into the household. And here, as you can see, there's a note that only 44 households responded to this question, and the question allowed the possibility of providing more than one answer. So next to asking for financial aid, there is a need also for food items. And the third need was related to medicine, because they have chronic diseases, or they have household members who are 80% handicapped, for example, so they cannot leave the house to obtain the medicine for these children, yet they cannot have any way around this difficulty. And we have some anecdote evidence from the households stating what sort of difficulties they went through to obtain or secure the needed medicine for their children. And as you can see that only three household representatives stated having the need for hygiene items, meaning that maybe you have come across similar news, maybe that UNHCR has been working with a couple of NGOs in different areas or in different provinces across the country, and they have been delivering hygiene items for free for the forcibly displaced households across the country. And maybe this is why the reason why there is no emphasis on reaching hygiene items. And from there, we went to the implications of COVID-19 on reachability to basic services. When we asked them about food items, 24 household representatives stated that they suffered a decreased reachability because they stated having the curfews during, or like that took different forms in the last 9 or 10 months. And it is also because they have to stay at home. They were not able to, even if the curfews did not cover their, for example, age group, or they were healthy enough to go out, but because they had to attend for the sick or children that they have, sick members or their children they have in the households, they couldn't go out. Because even if they couldn't go out because of having a chronic disease, for example, or being in an age group that the curfew covers, well, most of the time below the age of 18 individuals were not also allowed to go out. So they were like actually stuck at their houses, and they couldn't actually get the food items they needed. And then it is also, we've seen that 18 household representatives stated that they have decreased reachability to hygiene items as well. And please do not make this, do not let's confuse you with the slide before, when I said only 3 household representatives stated the need to reach, or like the need for hygiene items, because that was a multiple, not multiple choice, but they had the option of like answering more or stating more than one need. But when we looked at the specific answer of this, or when we look at the answers of this specific question, we've seen that 18 household representatives stated that there's a decrease in accessing the hygiene items. And it's also because of the same reasons I mentioned for accessing food items. When we asked them about accessing health services during COVID-19, only 5 people, or 5 household representatives, said they could not reach health services. And this is why, or the reason behind that was that hospitals started taking online appointments before you have to go to the hospital. And if you go to the hospital without having an online appointment, they were rejected from being admitted into these hospitals. 2 out of these 5 households, they had chronic diseases, and they had really difficult times to secure the hospital appointments. And they did that in cooperation with NGOs who were trying to help them out with this particular point. Now, again, when we looked at the children educational level, at the beginning, I said it was 136 children. It's 139 children who are in schooling age and living at the time of interviews in the households that we went to. Out of the 139, only 77 children attend the schools. And the remaining ones who do not attend the schools, it's either because they are handicapped or they have not reached enrollment age so far. And you will see an enrollment rate of children depending on, like, male, female breakdown, and Afghan and Syrians in the final report. But here I wanted just to highlight those who are attending schools at the time of interview. And when we ask them about what sort of implications did COVID-19 have on your children's accessibility to education, 13 households stated that their children were not able to access e-learning platform, that is EBA. And those 13 households had an average number of children that is equal to 3.5. And when you see, or when we look at the reasons why they could not access EBA, you see a variety of reasons. The top reason is not having internet, because they said that I cannot pay 75 or 80 Turkish liras a month for an internet subscription. Those who had internet, they didn't have devices such as a tablet or computer. And because they had 3.5 children on average, having a smartphone was not actually the easiest thing to do, because they started either prioritizing who would attend these classes. So one day would the eldest child would attend all of these classes. The second day, the middle child would do so, so on and so forth. Other households stated that they didn't have TV to actually follow up with the classes not broadcasted over EBA. And some of them said, or like one household said that they are not aware of what EBA is. One household said, I know what EBA is, but I don't know how to establish the connection. And other reasons include that one household representative told us that their children or their child asked the teacher to actually tell them how they could access EBA, but there was no feedback from the teacher. And the other reason was, or the other household, the remaining household there said that it's not related to COVID-19 per se, but because my child reached the age of enrollment in March this year, when I went to school to enroll my child, that household was an Afghan, I guess. They asked for several documents to enroll the child, and because the household did not have the necessary IDs or like the documents the school asked for, that child is not attending school nowadays. And finally, and this is my last slide, when we asked them about whether the COVID-19 had any motivation for them to repatriate, 37 household representatives said that no, we don't want to return to our countries of origin. And this is not related to the breakout of COVID-19 or not, but this is our final decision. However, there are two undecided on their will to repatriate or not. And this is related to actually having children who are going through treatment process. And they said that maybe if our children recover and they go back to normal, maybe we could think of repatriation, but at the time we are still undecided. And there is only a small fraction of households who said, yes, we would repatriate. And for example, among the Afghans who said, yes, we want to repatriate, two of them are the university graduates that I highlighted at the beginning, because they said that it's our country and we came here to study and we want to serve our country based on the education and experiences that we accumulated. So maybe our country could become like Turkey one day. And with that, I thank you for your time, and I would be more than happy to have your questions. Thank you.
Thank you, Omar. Thank you for this comprehensive presentation. I am giving the physical clapping, and the rest will be the virtual clapping. So the floor is open for questions. If you have any questions regarding this research, it has been, as Omar said, it's been a comprehensive research, and he only presented a certain fraction of it. And I have one question while we're collecting. You can either like raise your hand to ask the question, or you can use the chat function to ask your questions. Before we gather questions, I think I have a question that I would like to raise. We prepared a short summary of like a report together with Başak Yavcan Hoca. It's going to be out soon, but it is very small. It's very comprehensive. And it kind of reflects to your findings as well. But in terms of your findings, because you mentioned in the beginning that you looked into the local government support and the state support, right? Yes. These are the support that you were looking into. What was it? What else was included? Like, is it the international organization support is included in this access in the scope of your research, or private sector? Could you please elaborate on that a little bit more?
As you said, Professor, yes, we looked into the policies of municipalities in these three districts. But when we looked at aid or services provided by NGOs, if we have to say that international organizations have been involved in that or not, I think only Turkish Citizenship could qualify under that category, because it's a member of the greater IFRC group. But aside from that, we spoke with local NGOs. One of them is ASAM, which is one of Turkey's biggest local NGOs. We spoke with IGAM as well, and we spoke with NGOs that focus on particularly empowering women and children, but they are local NGOs. They are Turkish NGOs, particularly covering the needs or empowering children and women.
Okay, I see. And did you see any difference from these donors or supporters? I mean, did they continue with what they were continuing, or there were special, mechanisms that was developed during the COVID-19?
Well, there were special mechanisms developed during COVID-19, as the majority of these NGOs were restricted in terms of mobility due to the government decision. So they were, at the beginning, they stopped all of their services while they were in a transition phase to providing these services online. But then when they switched to online services, and here I'm talking about psychological support or like children-related sort of entertainment and education services, for example, households or the beneficiaries end, they didn't have the means to actually join these activities. As I said, they didn't have internet, or they didn't have enough devices to join these activities. And one of the, or two of the NGOs that we interviewed said that, well, for example, especially about the psychological support they provided, they couldn't secure privacy between the professional who was providing that service and the beneficiary who was receiving that service, in the sense of like, it used to be like face-to-face, where the beneficiaries would come to the facilities of these NGOs and sit in a private room, and it was like one-on-one. But now, because you are at home as a beneficiary, your children are there, so like you cannot actually have that sort of privacy, or you cannot leave the house anymore, so like you don't have that sort of let me say, privilege of like being alone to receive the eligible service. Another NGO stated that we've seen a return to basic services sort of like need, because at one point he said that the basic humanitarian needs, they were done by like maybe 2017 or 18, and since then we developed into, or like we stepped into the phase of actually having skills development programs, language skills, and vocational training programs as well. But now when COVID-19 broke out, the beneficiaries started asking these NGOs to actually, no, I want rice, I want food items, I want hygiene items. So two NGOs, that is Turkish Citizenship and ASAM, said that like we have seen this sort of trend from the beneficiaries.
Yes, I think that's one other thing that comes into the discussion, like what used to be like integration-related services or integration-related support converted into humanitarian support.
Yes.
So going back from integration back to the emergency support, I think that has been the trend, and I think that's what you are indicating as well. That has been a switch. Yes. In terms of the services or the support mechanisms. There has been some questions, so I will start asking the questions from the audience. And the first question comes from Aylin Topal, Associate Professor from the Political Science Department of Middle East Technical University. Aylin Hocam, hoş geldiniz. So thank you for the presentation. Is it always useful to reveal the problems and challenges empirically? My question is, what is the most surprising or counterintuitive finding of your field research? So what was the most, I think...
I didn't get the first part of your question, or of the
I think it says that it's always useful to, I think that was not is it, I think it was it is always. Yes, sorry.
Yes, I'm sorry. I meant to say it's always useful to sort of find things empirically.
Yes.
Okay.
So you basically the research really reveals the empirical findings to support some of the arguments we were guessing, but not necessarily scientifically proven. But I think your research reveals these problems and challenges empirically. So it's a thank you.
Okay, thank you very much, Professor.
So what is the most surprising finding in that regard that you found?
The most surprising part that I found actually is not related to particularly the findings from the households, but it is related actually to the municipalities' response or their scope of inclusivity to forcibly displaced migrants during the pandemic era. Because the findings that we came across with regard to households and COVID-19 implications, it's not particularly new to our work, but we somehow, maybe the one thing that we tried to do differently is having this element of comparison between particularly Afghans, the second largest group of forcibly displaced migrants in Turkey, and Syrians. And I have to say that one of the surprising findings for me was at the municipal level. We've seen three categories of policy responses or like inclusivity scope. There was a municipality that is not inclusive of forcibly displaced migrants whatsoever, prioritizing citizens in their response. There was a second municipality that was in between, like trying to actually for political reasons serve the citizens, because they openly said that, well, we have elections we upcoming soon, and we need to keep our performance under certain check and balances, but at the same time we are trying to actually extend aid for Syrians and Afghans, but we have budget related constraints. And that particular issue we dwell into in details to say that municipalities hiding behind budget restraints is not valid anymore, because there are examples from other provinces showing how to overcome this budget restraint, and it does not necessarily have to be through more allocation from the central government in Ankara. The third example that we came across in terms of municipal response during our work was actually running a positively discriminating policy toward forcibly displaced migrants, saying that no, we don't have that sort of discrimination or status discrimination between citizens and non-citizens. We serve equally anybody who is in need, and because we know that forcibly displaced migrants are actually in need more to this aid because of their legal status and the limitation they have to reach what Turkish citizens could actually arrive to. That's why we, at certain point or at certain aid types, we prioritize forcibly displaced migrants.
Okay, I think it's an interesting finding as well. And that's something that I would like to elaborate a little bit further after we answer these questions too. There are some more questions, because I also found that in our research that we were making, it's interesting how some of the international organizations responded. So it's very disproportionate. For example, yes. In Izmir, like they support lots of local governments, but why in Izmir? Why not Kilis, for example? I mean, I should raise this question to the international organization who's supporting it, obviously. But I see that there has not been like an equal distribution, equal focus, and some of the provinces or certain cities received more funding than the others. So that's also quite interesting. The second question comes from Duygu. Duygu Toprak, one of our master's students. Hello, and thank you for your presentation. I have two questions. Firstly, you said some children were not able to access education due to being handicapped. Are these children's families aware of the existence of special schools in Turkey for children with different physical or mental impairments? Though I don't know if these children are allowed by law to attend these schools or referred by local authorities. So were you able to receive any information on that during your?
When we asked that question, they actually said that no, we are not aware of similar type of schools in Ankara. And aside from that, in some cases of, or like certain households, we came across the following. You have a handicapped child, and one of the parents, or this was actually particular to single parent households, and the mother or the father is actually also suffering from sort of psychological trauma. So we have one child basically who's 17 or 18 or even 19 at one point, who actually have to stay at home to attend for both the sick parent and the sick sibling. So the chance of actually just going out of the house to ask, even if they become aware of something like this, is next to impossible.
So they're like caretaking the situations also happening
Yes.
at the same
Yes.
time. That's
Yes.
the case. Okay, I see. And the second question by Duygu, there's Eray's question, but I think I'm skipped to Duygu's question because there's a follow-up kind of, oh no, that's a different question. So, okay, I will ask Eray's question then. Thank you very much for sharing your research. I have a question regarding university enrollment, whether you have any knowledge about the effects of the COVID-19 on the university enrollment level of Syrian and Afghan students in Ankara. And Eray is
that was not included in the scope of this particular work that we are doing. So I have to say no, I have no idea about that.
Okay, I see. And the third question is about from Duygu as well. It's about the question: while the repatriating perspective of these participants for law, do they see a sustainable future for themselves in Turkey, and what are their hopes on gaining citizenship, or they even care about gaining a citizenship? So they're planning to stay in Turkey. They're not going back, it looks like it. But what are their plans basically in the future? They're planning to stay and gain citizenship. So
one actually household stated or indicated the wish for obtaining Turkish citizenship, and this is related to that specific household representative having an idea of like opening business and investing. Sorry. So he said that it's a little risky to do the investment that I have in mind while he had the residency permit. And he said, like, this is not very much secure. Like, I don't feel secure enough to do the investment that I have in mind. So why don't they give us Turkish citizenship? And he said that I've been here for the last 10 years and I speak Turkish fluently, but like, we are not included in this like scheme, he said, and I quote, given only to Syrians, end of quote. So there is a sort of like, I don't know if the right term would be here, jealousy or envy, particularly from that specific Afghan household, on why it is only Syrians who are getting this exceptional citizenship. But the remaining ones, they were actually asking on improvements in their legal statuses, because people said that like, if there is unfairness in the world, it should be equally distributed between us and Turks. Like, because we are Syrians and we are under temporary protection status, for example, we cannot if we have to get a work permit, we become subjects to our employers. If we want to check on our families who are residing in different provinces, we have to take a permission, and nobody gives us that permission. If you want to enroll your children at school, they give you tons of or a list of like requirements that we cannot obtain from Syria. Even if we wanted to go, for example, we cannot leave the country because of this legal status. So there were demands on actually a way out of temporary protection status into something more sustainable, legally speaking, so they can have a greater margin of maybe participation in the society, and have this like maybe sense of like being equal to everybody else surrounding them.
I think maybe some other kind of status before becoming a citizen, something between the temporary protection and citizenship, some other kind of legal status which will make certain things much more easier or much more straightforward.
Yes.
Right. And I have a question, because when you were describing the issues that are the challenges during the pandemic, it looks like accessing to online resources seems to be the most critical and most difficult challenge.
Yes.
And considering the situation, considering the income level of the households, and you described quite in detail, and I was totally not surprised, but the income level and the expenses and the needs right now, while we're accessing to many resources online, it shows that first of all, and the education level, these are all like negative kind of elements in terms of the restraints on online access, right, to various services. Did they have any suggestions? Did the households have any suggestions, or do you have any suggestions on what could be done better for the Afghans and the Syrians to have better access to these services that are switched online right now, from education to healthcare appointments, etc.?
I would say that there wouldn't be one answer to actually have that could be comprehensive as a reply to all of this, Professor, because first you have, for example, the element of language skills, because some households stated that yes, we do have internet and we have devices, but now, as in many countries where like countries hosting immigrants, especially when they are not speaking the same language, a greater responsibility fell on the shoulders of the parents, because now they have to follow up with the teachers over WhatsApp. They have to actually now tutor their children if they do not understand enough or fully what the teachers are talking about. So there is that, for example. So there is the classic need of for Turkish language skill is one part of the answer to that. 1, 2, when you have that sort of income level and you cannot, for example, access EBA for the lack of internet or for the lack of devices. For example, Save the Children distributed 250, I guess, or 500 tablets at the beginning or at the onset of the COVID-19 breakout. But 500 tablets in Turkey, it's we need that only for one district in Ankara. So it's they have limited funds, and they have to actually also give as many countries as possible. But then at the same time, if you look at the example of Gaziantep, in that regard, they said Askia tablet, I guess the name of the campaign was that, and they were aiming for collecting 100,000 tablets for children who are in need. But then they do not complement similar statements with how many are for example, Turks, and how many for Syrians, and not for the sake of giving data, but just to understand who's actually more affected, or who's more negatively affected by the COVID-19 breakout. Is it Turkish students, or is it forcibly displaced migrant students? So there is, and as you said, there is no equal distribution in the campaigns run at the local level. Gaziantep is doing that because, well, one could argue that there are 500,000 Syrians living there, and around maybe 70,000 of them are school age children. But in Ankara, we have 100,000, but we don't know how many school children or children are at the schooling age. So there is no particular answer that could answer the questions you raised in one phrasing, because it has multiple ways of answering that. One could be financial support. One could be actually what Mansour Yavash is doing, like to 100 villages, free internet access. So why not, for example, do something similar with those Turks and Syrians and Afghans, equally speaking, who do not have internet access? Like, why we also need to look at the urban setting of the province as well. So like it depends on, like, the needs assessment that we need to have first, and then devise our let me say policy responses according to what sort of needs that we have.
I mean, I absolutely agree. I knew that there was no simple answer, and I was not really expecting a simple answer to this complicated question, obviously. It was more like a brainstorming what could be done, and I totally agree with you. I think this is a problem in general, not only related to Syrians or Afghans. I think this pandemic just showed how this in terms of equality to access to education has this gap has been widened so drastically, and even more advantaged students and families like considerably, like myself. I noticed yesterday that in the WhatsApp group of my kids' school, there are apparently special classes being taken by some students because the families requested that from the school, and the school decided to make it possible for some students. And suddenly I realized that this is inequality between students, because some families are demanding it, asking it, getting it. Some families are providing private schooling. Some families are doing different things. So as you can see, like the gap is widening quite drastically. Even for students who can even have access to education, and I cannot even imagine for students who do not even have access. And this includes also, as I said, Turkish, non-Turkish students, university students even. We had to run campaigns for our students to access internet devices. So that's I think a global phenomenon right now. But obviously, who has affected the most, as you mentioned, is very critical in this situation. So and certain things has to be done, despite the fact that there are various challenges for host community and also refugee communities all at the same time. We're all in the same boat. And
I would like to add one thing as well, Professor, because we somehow not we somehow we added few points related to Turkish students accessibility to online education, not through our work, because our work did not cover Turkish households, but we've seen that out of the 18 million Turkish students, 6 million could not register with EBA. And when we looked at the availability of devices at Turkish households across Turkey, we see just like, having a desktop is like around maybe 27%, having a tablet is around 33%, having a laptop is around like maybe 39%, but 99% of the households have smartphones in their hands. Yet 6 million students did not register with EBA. And then when we looked at the ranking of Turkey in terms of household accessibility to internet among OECD countries, Turkey ranks below the average of OECD countries in terms of like internet penetration. And we're talking about 2.5 or 2.6 million households in Turkey who do not have any internet connection. So while we have this in the greater population, we should not say that, like, it should not be surprising that forcibly displaced migrants in the country are having similar, if not even worse, conditions into accessing the education platforms devised for COVID-19.
Yes, I mean, you're absolutely right. When you look at the numbers, it's pretty obvious. And also, you have mentioned one issue as well. Like, there's more than one kid in the or school age child in the family. And if that's the case, even you have one tablet or phone, that is going to be used by that child. And also consider the fact that most of them are as phone access, and that phone could be with the parent who has to go to work. So there will be no device in the family or in the household during that time. I mean, there has been certain campaigns that's been run by the internet providers during that period, that certain mechanisms should be developed, like free internet. That was hilarious because I get a free internet package from my mobile phone company. I'm not going to mention which provider was that, the service provider, but I entered METU, and the moment I entered METU, I received this text message: "You're now in the premises of the university. You have free access to internet." And I'm thinking to myself, I have free access to internet in my university anyways, because I have the Wi-Fi. I need it outside, not inside the university. So I think this could have been run better, definitely for sure. But it doesn't look like it is ending anywhere. So maybe from this point onwards, through these reports, certain policy decisions can be supported in terms of internet access, tablets, and also community building. I'm very surprised to hear that some families didn't even hear about EBA, because you assume that the community will tell you that now it's moved to the online education. Like when you talk to your neighbor, your friend, they will tell you that there is EBA. There is such a thing called EBA. Whether or not you can access to it is another question, but at least not knowing is, I think, very surprising to me.
That is true, and just also like a point of one of our findings also tapped into this free 8 gigabytes announced by Monet. And I think 80% of household representatives said that, like, no, I don't know what is this like free campaign for like 8 gigabytes. And this shows you that even if you become aware of like something like this, if you do not access your account on your like internet provider, like the web page, you have to do it on the application on your smartphone. If you do not access it there, it, like, I can see it as well when I access my account, it says like, there is an 8 free gigabytes, but like if you do not access it there, you cannot see it, and hence you cannot benefit from it. So this takes us back to like, language skills, and maybe it could have been like maybe a second phase of this work could actually dwell into how well integrated they are, for example, because integration is not only, or like part of it is knowing the language, but then also being able to navigate the services provided by not only NGOs, but government institutions as well in similar cases. So what does it mean that like I have a C1 Turkish level, but like I don't know how to access similar services announced by the government? It seems that that would show that integration is not only about language courses. There should be some sort of like let me say structured integration courses maybe that shows, not specific to COVID-19, but like, that dwell into what does it mean to become integrated in Turkey, what sort of services public institutions offer you, and what sort of services you are eligible to.
How about leaflets, like in languages that are, for example, because like certain announcements has been made online, and it looks like if you're not following the social media, and even if you're following the social media, if you're not following in the language that you can understand, you're not going to be able to get access to this information. How about leaflets, like physically printed leaflets that's going to be distributed? But then it comes to my and then I recognize the limitations on that physical leaflets have to be distributed in person, which is also a health risk. And also you have to be able to read and write. You have to be literate to be able
Yes.
to be able to explain this. There are various challenges. It looks that different mechanisms can create.
Yeah.
Okay. Are there any further questions to our speaker? Okay, doesn't look like it then. I will then say thank you to Omar Kadkoy for being with us today and sharing this work. We're looking forward to seeing the final report. And we would be very excited to read the extended scope of the research.
I am equally excited, Professor, but like, it's like, you add one point and then like you have to like modify certain things. I'm equally excited. I have just to say that just to see like the final report coming out as well, and anytime soon.
And it's when is it going to be available? Any guesses?
Well, I am hoping next week because I need to get done with it. So
Okay.
like, you know, I stretched my let me say availability of extensions in a way that, like, you know, I cannot run it beyond next week. So like I'm doing my best to have it published next week, hopefully.
Okay, great.
Yeah.
Great, Omar. We're looking forward to it. Thank you for joining us. It was great to hear from you. And this is really a timely topic that we discussed. And thank you so much.
Thank you very much, Professor. Thank you very much.
See you in another METUMIR presentation and seminar.
I hope so.
Take care.
Thank you very much.
Thank
Have a
you.
nice day.
You too. Bye-bye. And bye, everyone. I would